Hi, in today's video, I'm going to be talking about this one question that comes up quite often, that which is a better bypass? We're going to be talking about these two commonly performed bypass operations. One is the mini gastric bypass, or also called the one anastomosis gastric bypass, and the other one is the Roux-en-Y gastric bypass, also called as a double joint gastric bypass. For those of you who don't know me, my name is Dr. Arun Dhir. I'm a gastrointestinal and a weight loss surgeon, and I've been practicing my craft for over 3 decades. I've done over 5,000 bariatric operations. Now, with the gastric bypasses, let's get it very clear. It is an operation which is considered to be in the topmost or the most powerful category of weight loss operations. And it is generally considered when the BMI of the individual has gone over 45, or they have developed problems like diabetes, sleep apnea, their cholesterol and their blood pressure is high, or they have already had some previous surgery and they need it to be revised to something else. What is the difference between the mini or the one anastomosis gastric bypass and the Roux-en-Y gastric bypass? Let's have a closer look at these images. In the Roux-en-Y gastric bypass, what we do initially is we make a small pouch of the stomach and we attach a segment of the small bowel to it. So the food comes down the food pipe into the small pouch of the stomach and it goes straight into the small bowel. The remaining portion of the stomach and the small bowel is alive, it's working and it's making all the juices. However, these juices mix with the food coming downstream at a joint that is made lower down. So there are two joints, one at the top and the other lower down. That is called the double joint or the Roux-en-Y gastric bypass. The one anastomosis or the mini gastric bypass, on the other hand, as the name suggests, has only got a single joint. We make a longer, skinnier pouch of the stomach and we measure about 150 centimeters of the small bowel and make a joint with the lower end of that skinny pouch. So food comes down the food pipe into that small pouch of stomach and it goes straight into the small bowel. This one joint also is the point where all the stomach juices and the small bowel, which is still alive and working, is coming downstream and is mixing with the food from that joint point downwards. So the question then becomes is, which operation is better? Now, let me be honest in saying that each operation has got its unique risks and unique benefits. The mini gastric bypass has got this one downside, which is of bile reflux. It's basically the bile which is coming from the small bowel. It comes and it goes from the stomach into the esophagus, which can be slightly different to the acid reflux. The Roux-en-Y gastric bypass, on the other hand, has got the risk of bowel twisting internally, creating bowel obstruction and internal hernias. Plus, the risk of two joints versus one joint is always there. Understanding that every time we cut the bowel and join it together, there is a risk of bleeding and leakage. So mini gastric bypass has got this advantage that it's only got a single joint. However, if an individual has got significant gastroesophageal reflux, then certainly Roux-en-Y gastric bypass is a more preferred option. But I think what is more pertinent to look at is how do these operations perform in the long run? Because ultimately, we are considering these options because we want long-term success. And in order to substantiate my response, I'm using reference of this study, which was published in the European Journal of Obesity in 2018. Now, the thing that is really catchy and powerful about this study is it is a meta-analysis. Meta-analysis means they have not just done one study and given the results based on that. They have included a wide number of studies, and these wide number of studies were taken from PubMed and Cochrane. Now, these are medical libraries that have got a huge database of literature, including studies and reference articles and all of that. So they selected 12 studies out of their search criteria, and then they came out with some really key conclusions. And I'll go straight to the conclusions because that's what you want to hear. And what they found was that there was a very comparable outcome between the mini gastric bypass and the Roux-en-Y gastric bypass in terms of the surgical risks, which is risk of bleeding, risk of infection, risk of ulcer formation and things like that. But there were these three key things which were really highlighted, and they came out in a very sort of, clear-cut manner. What they found was, number one, that in terms of weight loss was more substantial and maintained in the group of mini gastric bypass at 1 year, 2 years, and also at 5 years after surgery. So mini bypass provided a more substantial and a more durable weight loss. The second thing that came out was specifically in terms of type 2 diabetes remission or treatment. What they found was that the so-called quote-unquote cure rate of type 2 diabetes with mini gastric bypass was higher and more durable in comparison to the Roux-en-Y gastric bypass. And the third thing, which was very comparable between the two, was the benefit of improvement of high blood pressure and high cholesterol. So in summary, I would say that there is no one size that fits all. I would always recommend that it is best to discuss with your surgeon based on their own experience and the procedures that they offer in light of your unique situation as to what would suit you the best. As Jamie Maisel says, that there is no one solution to all problems. It is the problem that leads to the solution. So I hope you found this video useful. If you did, please do subscribe to my channel and share it with your friends, because it is only in sharing that we all collectively grow. Thank you.